Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you today. Of course, Hawkeye is here with me. We're also joined by some really important folks and some great folks today. Mario Castro is the head of our research operation here at the University of Kansas, the Clinical Trials Unit. He's also the Division Director of Pulmonary Critical Care, which makes him one of my bosses. So treat him nice. We're delighted to have him back. Mario, welcome back on our program today. Mario will be helping us address vaccination. We're trying to get online Dr. Barbara Pahoud. She is the Research Director of Pediatrics Infectious Disease at Children's Mercy. Barbara is a part of the AstraZeneca trial, as is Mario, and so she should be popping up here in just a moment. We're trying to get that live with our van. And then Dr. Mark Steele, who's the Executive Chief Clinical Officer at Truman Medical Center, University Health over at Truman Medical Center. Mark, welcome back. Mark's been on in our CMO program. Mark and I have worked a lot together over the pandemic, and so I'm delighted to have him on. He's also part of this vaccine trial, and we're going to get into that discussion in just a moment. But before we jump into all the vaccine update questions and thoughts and controversies, Hawk?
Yeah.
Okay, it's a little better.
It's a little bit better.
It's a little better here. Okay, you're right now.
When we know with coronavirus, we just have to see what the day brings, really. We will have vacillations of higher numbers, lower numbers. We certainly want lower numbers. Today we have 77 active or acute infections in the hospital, with 36 of those in the ICU and 13 on the ventilator. We still have 45 that are in that recovery period and 3 on the ventilator. So, I'm encouraged by this, but we know with the number of infections, we just have to anticipate that probably the number of hospitalizations will be increasing in the next week.
It does bounce up and down all the time, and we're going to talk a little bit about that here in just a bit, but I think look, 85, not great. We're not at 90 or 100 right now.
Right.
But so 77's down just a little. It may be we're hit this equilibrium for whatever of things are going on in the community, and then you just hope that some of the big news coming out is going to make a dent in this, like mask mandates and things like that.
Yeah, absolutely. And mask mandates, I think, are extremely important, especially when we talk about our partners out west, in those rural areas, because we know that those areas can get hit extremely hard, and the amount of resources they have compared to the more urban areas are not as great. So unfortunately in Hayes, they do have 36 active inpatients right now. 33 of those are active and 3 of those in that recovery period as well. They do have 2 that are intubated as well. So, they have a large proportion of their hospital capacity that are now filled up with just COVID beds.
Yeah, that's tough. Mark, how are things over at Children's Truman?
Hey, good morning, Steve. We're doing okay here at Truman, and today we have 44 patients in the hospital. We have 10 in the ICU and only 1 on a ventilator. We were at our high point this past Monday when we had a total of 49 patients. So we're hoping, like you're hoping, that we're going to see a little bit of a tick down.
I like that plan. Here's what I'm hoping is that we're getting a little further from Halloween, so maybe that reverberation has stopped. And then maybe people are following the pillars a little more closely. Schools are going more online. I think that's probably going to help a little bit. And the more people mask is going to be a huge win. I'll just tell everybody, I'll be upfront about this, and it comes as no surprise. You guys have heard me give the 5 rules before. We the people, we're all in this together. It's not either one. Number 2, do the right thing. Follow the pillars of infection control, which really gets right at the core of this question about wearing a mask and making sure that we remember that we're all in this together, and what we have is freedom with responsibility. And I think it's a social responsibility for us all to wear a mask right now, because it helps keep us safe, and it helps to keep the community safe and keep hospitals open and keep businesses open, because this disease gets any more widespread. I think we're going to have a tough time not having a complete shutdown, because the hospitals won't be able to take care of the patients, and we have pushed up against that barrier all week long. And so I'm all about, I think the mask mandate that the state of Kansas is putting into effect is extremely important, and I think that it will make a real difference in our ability to make sure we can keep people safe. And we're going to talk about the other side of this equation, because that 3rd rule is be the bridge, because real hope is on the way. That if we wear a mask and we follow the rules, it's going to get us to the next day, and the next day is when we start talking more about the vaccinations. We're going to get to that in a moment. Ask questions, seek answers, because I think everybody has the right to have an informed, calm dialogue about this. And then the 5th one, those who laugh last, because if you can stay healthy emotionally and mentally, helps us get through that crisis. Mark, your thought about the mask mandate in Kansas now and what you're seeing in the Kansas City metropolitan area.
Well, yeah, so I personally am all for anything that improves compliance with these pillars of infection control that you just alluded to. And so obviously masking is extraordinarily key, not only to protect ourselves, but to protect those who are around us. And I think we have some evidence that where there have been mask mandates, that the compliance is much better than in areas where there is no mask mandate. And certainly here in the Kansas City or the Missouri side in Kansas City, Jackson County, having a mandate, my observation has been that as I go about my way and into the community, that masking seems to be the rule rather than the exception.
Yeah, and I totally agree with you. I'm fully supportive, and I'm delighted that Kansas has taken that step. I'm delighted that the Core 4 has taken that step, especially Jackson County, Kansas City, Missouri, Wyandotte County. Johnson County has a few exceptions to their rules, so it's a little harder to understand how that's going to work out as well. But hopefully that'll get improved. And I think this will all make a difference because it's all about the equilibrium out there and how fast the virus is spreading. So, you know, we really appreciate all these steps that have been taken by the elected officials and folks trying to double down on their efforts, because if the wrong actions continue or we don't take more aggressive actions, then it is going to present a greater challenge to all of us in healthcare, and that includes meaning the greater challenges to the economy. The vaccine clearly gives us hope. We have got to bend the curve. So I want to also say, I see Barbara Pahood is now on the line. That's great. Welcome. We're just going to wave. Good morning. Uh-oh, we're not hearing her yet. Okay, it's coming.
Oh, the IFB's out.
All right.
Super
well, let's first.
up.
Yeah, we're getting a nice close-up. We'll get back to that in just a second, Barbara. Let's first turn to let's turn and see if there are reporter questions on the line.
Yeah, I've got one. This is Roxy Hamill, working for KCUR this morning. A couple of days ago, you all talked about possibly shortages upcoming of nursing staff, making it difficult to actually expand your bed space for this surge. So I wonder if we could explore that just a little bit. Can you tell us, what your experience has been at your institutions, whether you've got beds right now that you cannot fill because of the shortage, or and the second part of that is how you're planning for future shortages should they happen. Are you going to look more towards hiring temps or hiring travelers? And how possible is that?
You bet. Well, here's what I would say. I would say that there are a couple things. So we're very happy that we're able to staff all of our beds at KU. That's a great thing. We're actually staffing more than our beds because we're staffing alternate care areas. So when we've been running out of beds, we've been going into other areas like the anesthesia recovery units and slowing down the operating rooms so that we could use some of the post-op beds as a place to keep patients. We've had patients holding overnight in the emergency room for prolonged periods. There have been times we've had 25 or 30 patients in the emergency room waiting on a hospital bed. And then there are the dialysis unit or the GI endoscopy labs. We're staffing those we call alternate care areas. So we're staffing all of our beds. The problem is we have more patients than we have beds. And so that's the struggle. And I don't know that we have staff to open up a tent. In fact, I think that's one of the big questions. People say, well, are you going to open up tents? The problem is that to do that, you've got to have staff to do that. And I think that's been a challenge for us. So we're staffing all of our beds. We actually hope to open up some additional beds in the near future. It's going to be a small number, but I think that we've got some plans underway to try and do that. Mark, how are things with you at Truman?
Well, we clearly are intermittently having challenges with staffing, and so it's kind of a day-to-day thing. We're doing okay, but we certainly have some concerns, and obviously are trying to reach out and get as many staff as we can, getting agency staff and even exploring travelers. And so that is a concern of ours.
Other questions?
Hey there, this is Nick Starling with 41 Action Davis. I was just wanting to know, as we talk about vaccines, how are you preparing to store the vaccines? I know Pfizer you have to store it in very cold temperatures. Are you having to buy fridges, making space for the vaccines here in the next few months, and what are the preparations like?
And I think we're going to have a pretty thorough discussion about the vaccines in a moment. I will tell you on the storage side, that's one thing we're very lucky about at KU, because we have a lot, because of the university side here, they have a lot of research freezers in which things are often stored at very cold temperatures anyway. So we have storage space for the vaccines. Mario, any things you want to offer about that?
No, it's a very important point where we do have that capacity built within our research labs, which is excellent. And in fact, I think when we think about the distribution scheme, we have to take that in consideration. Where does the ultra low required vaccine go to? It needs to go to areas that have access to ultra low freezer space.
Yep, you bet. Mark, how about it, Truman? Do you have a plan for storage? Or I know we may be a storage and distribution hub in Kansas City. That may be part of our story, I think.
Yeah, no, we have that ability as well here. We have some ultra low storage, and actually we have some on order and expecting it here toward the end of the year. So we do have the capability to store the vaccine.
Yep, because you guys also have research labs as well, and I'm sure, I think we're probably both campuses are blessed by that academic side, which gives us a little bit more access to some of that equipment.
Yeah, certainly our affiliation with University of Missouri, Kansas City helps us.
So we're going to get into some more vaccine questions, though. So I don't want to not fully answer it, but I also want to put some of those answers into the rest of this program that we're coming up to. So other questions? Jill, go ahead.
Oh, okay. Sorry. It's Roxy again. Back to my question on the staffing, though. You all said that you have staff right now, that you have concerns for the future, but I'm wondering more, what kind of steps are you going to have to take? Surely you're planning at this point on what will happen when you need to expand those beds and you need more staff that maybe isn't available right now. Might you be hiring more people, traveling nurses, or other types of temps? What's in the future for you on that?
So, that's a great question, and without trying to go through every one of our steps, but here's the challenge. In the last time when there was a major outbreak like in New York, most of the country was not affected. Today, if you look at the map, so much of the Midwest is affected, right? The whole Midwest. And now you're seeing it in New York again, you're seeing it on the coast again. California's got rising levels. Washington State has rising levels. So it's really, this time around, the whole country is being affected. As a result, traveling nurses or staff or temps or PRNs are all being pulled in many different directions. And so it's a bigger challenge now than it was before. So it's harder to answer the question because the obvious answer is, well, let's get some temporary people. We'll get the traveling nurses or people of that different type into an institution to have work, but they're just not as available as they once were because everybody's scrambling for the same pool of folks. There may be military options if you have to build a tent under extreme conditions, and I know that went on in El Paso. We had the dean of the school talking a little bit about that with us last week and some of the steps they had to take. The problem is the military is really stretched thin right now as well, and as the pandemic grows, that becomes a greater and greater challenge. So I think what the flip side of it is that we have to really work on the pillars of infection control, and that's why we're so pleased with every attempt to try and increase masking, smaller group size, and social distancing. Those are the things that are going to really bend the curve, because we can't just keep doing what we're doing. To your question, are there other plans? We've worked on all sorts of other scenarios. Staffing ratios, trying to get students graduated early. I mean, there are all sorts of ideas out there. Those are all extreme measures because every time you take one of those measures, if you're that overwhelmed, I think the data out of New York and Italy and other places show that, patients don't do as well because you don't have the right staffing ratios and you're spreading people too thin. So we're going to do everything in our power not to do that. And one of the things and that's why we so applaud the efforts being made here by the Core 4 and the metropolitan area, by the state of Kansas, to try and help stem the spread of the disease. Because we've got to focus on that, because bending the curve is the best thing we can do. The second, you also have to remember that once we fill up with COVID patients, who takes care of a heart attack or a stroke or any other problem, or your cancer surgery? So, we've really got to be responsible, because healthcare is not an unlimited resource. And there are not unlimited people to take care of unlimited numbers of sick patients. And if we start thinking, well, I can do everything I want and you'll just have to handle it, well, that just doesn't work. I mean, what math can work like that? No math works like that. And I think we have to be thinking more responsibly and more kind of in that thing, we talked before about we the people. We are in this together. So the direct answer to your question is we have plans. Those plans are imperfect at best. They rely on a pool of labor that may or may not be available. They rely to some degree even upon the most extreme situations about emergency MASH tents. The problem with that is that may not be available because the whole country's on fire. And the only way to put that fire out is for people to be really responsible about the rules of infection control. And you know how I know it works? Because right here in our hospital, and I know Mark would say the same thing, and I'll ask him, but right here in our hospital, we have, how many do we have today? 120 COVID positive patients in our hospital. How many cases of spread do we have to staff from a patient? And the answer is we don't. And the reason is good infection control. Masks work. And all this stuff about masks don't work or it's a conspiracy, that's just baloney. The proof is right here. And you just, at some point, you have to believe the science, because we're not trying to lie about it. There's no motivation to do this. Masks work. Social distancing works. We can bend the curve. What doesn't work is when you have an overwhelmed healthcare system and then you can't take care of people and people die. That doesn't work. Mark?
You said it very well. I mean, I agree with everything that you said. Just like you, we have contingency plans for staffing, but none of them are ideal. Changing the staffing ratios is clearly not ideal in terms of patient care. We also have contingency plans to utilize staff who are not clinically active, nursing staff who are in leadership roles and so forth, or educator roles, and to deploy them. And also we can obviously deploy staff from our operating rooms and from our clinics, but that would then end up deferring care for people who need it in those particular settings. So as you point out, far from ideal, and much more ideal is to really reduce the spread of this virus by practicing all the infection control pillars that we've been talking about.
Yeah, it's really all about that. And then you guys, I think, have a school of nursing. We have a school of nursing. We have a school of health professions, and we can start trying to get people into places early. And the schools have been really good about talking with us. But that's an inexperienced group thrown into a pandemic. Come on, we can do better than that. And we can do better if we follow the pillars. Jill, let's let on this morning we move into our discussion with on the vaccines for a minute.
Sure, and then when we go to community questions, if reporters are on the line, they can chime in then as well.
I think that's perfect. Okay, Barbara Pahood. Good morning. Are you on? Do we hear her?
Yes, I can hear you. Can you hear me?
I can barely hear. Now I got you.
Can you hear me now?
Now I can hear you. That's better. All right. We hear a little wind, but we can hear you.
Okay, great. Hi.
What's that big green thing behind you?
So that is the Matrix mobile unit. That's the unit that we got from NIH to help us enroll patients in communities that don't have access to clinical trials as easily as we do with our clinical research trials unit. So today we're parked outside in Olathe attempting to enroll Hispanic participants.
That's awesome. So what's the status? How's the trial going so far?
It's been challenging. For example, today the mobile unit was supposed to see 3 patients and they all canceled last minute. I think there's still a lot of concern about the vaccine. There's hesitancy. We have struggled enrolling both Latino and African Americans, and the general population that wants to enroll is not necessarily the population we are the most interested in getting. We can't have everybody be white, upper class people enrolling in these trials. So Mario and I are trying to do our best to make sure that we have a diverse pool of people enrolling, but there's going to be challenges anytime you do something outside of our usual norm, and this is the first time we've ever used a mobile unit to enroll for a clinical trial, at least at Children's Mercy.
Oh, good luck with that. So Mario, how is it reaching out to different communities? How's that going?
Well, fortunate, since I was last on the show, we're actually launched now with the clinical trial, with the vaccine trial. This is the AstraZeneca vaccine, the one that was developed at Oxford University. It is kind of the third in line after the ones that were recently released their results, the Pfizer and the Moderna vaccine. And we've enrolled now over 220 participants across our multiple sites. We've utilized the van that Barb mentioned at TMC Lakewood last week. That allowed us to enroll participants that were elderly and in an extended care facility. We are also launched this past week at Swope Health. So Swope Health, the federally qualified health center that allows us to enroll participants at Swope Health. And I was out there day before yesterday, and it's a wonderful facility. A lot of community members there that are exactly the target that we need to enroll into this study.
That and Mark, how's it going over at Truman?
Well, as Mario mentioned, the van was out at TMC Lakewood last week. And obviously, from our perspective, finding an effective vaccine vaccines is key to helping to protect all of us from the virus. And we obviously need to study the high-risk groups, which includes nursing home patients and the elderly. And so obviously, we were very excited to be asked to be part of the trial.
Yeah, that's a big deal. So, okay, now I don't know what you guys can say or can't say, but what do you think about the status of the vaccine program so far between Moderna, Pfizer, and then I just read today AstraZeneca is talking about some good early results in elderly as far as immunogenicity, I think is what I would say, or how the immune response. So thoughts, Mario, from that standpoint? How do you think that things are shaping up?
Well, I mean, we're just thrilled. I mean, right now to see the first two vaccines, the Moderna and the Pfizer one that you mentioned, to have over 90% efficacy is 95% efficacy with the latest update from Pfizer, suggests this is the right way to go. We anticipated initially that we would have 60% efficacy. We even powered the study down to 50% efficacy. But this is far greater efficacy than we've seen with the influenza vaccine. It is something that is exciting for us because we know this is the way to move forward, back to normalcy. The other exciting news from both of these large trials, now we're talking over 70,000 participants. Side effects were exactly what we expected. The side effects that we saw were those that we see from influenza vaccines. So muscle aches where the injection occurred, feeling a sore throat, some muscle aches, some malaise, having low-grade fever. All these happened exactly about the same level that we expected, and they were all, gone. We tell our participants, go home, take some Tylenol, sleep through the night, and by tomorrow you will get over it. This protection is unbelievable. If we can achieve this with our AstraZeneca vaccine here in Kansas City, we're going to be bending the curve.
Yeah, it's such a big deal. So, Barbara, one of the things, as I remember about the AstraZeneca vaccine, is it's going to be better for worldwide distribution because it doesn't require the hard handling. Moderna and Pfizer are harder to handle, but the AstraZeneca and the Johnson & Johnson one are a little bit easier to handle. Talk to us about some of just the pure logistics of getting a vaccine out into the public.
It is absolutely challenging depending on each manufacturer. This is one of the reasons why we need to test multiple vaccines. Some countries like the United States will be able to distribute the Pfizer vaccine easy if they have the freezers that can tolerate that vaccine. Moderna, for example, is actually going to be easier to distribute actually than Pfizer because they are able to keep it at room temperature for 12 hours, for example, before you have to administer it. The one that we are currently testing with AstraZeneca, we have up to 6 hours. So each one of them is going to have their own little differences. And that's why we need to test all these different vaccines, because each community is going to be able to bring one in a better way than another one. So variety and options is really the key.
You bet. Mark, how do we get into minority communities? How do we convince people that we're not here? This isn't an experiment. This is, vaccination is the right thing and the standard. How do we get folks involved with that? Because that would be a concern if we don't and we're not able to really convince folks in some of our most vulnerable groups to have this really important therapy.
Yeah, I think it's obviously not easy, but I think the important parts are that we go into the community like Dr. Pahoud and Dr. Castro and their teams are doing. And then obviously we have to be extraordinarily transparent about the process and very carefully describe all the risks and benefits, which are typically done with any kind of clinical trial.
Yeah, those are big challenges. Okay, Jill, let's turn to questions from our audience.
You got it. Barbara, if I originally registered for this trial, and haven't received a call, are they still enrolling in out-of-region areas like St. Joe?
Okay. Mario, what's the word on that?
Yeah, so our registry is really full, and so we have over 7,000 participants identified here for KU. I would suggest that you call us. Call Shelby at 314. I'm sorry.
314. Mario, 314. Come on, man. Mario came from St. Louis, and he's been. How long have you been here now?
A year.
Yep.
I'm still in 314.
You'll remember 816913. It's coming to you.
It's been a time warp. You know that. Please call Shelby at 913-574-3006. This will allow us to get you up in the line and get you into one of our slots at one of our sites. The other way to enter is go ahead and register if you haven't done that already at preventcovid.org and put in KUMC there. But really contact Shelby. That's going to be your front line to participating in the vaccine trial. And I think it's very important for us to mention that even as these early vaccines get emergency use authorization, they're going to be quite restricted, and the distribution is going to be quite difficult to get to them unless you meet certain criteria. So help us with the vaccine. Help us with the vaccine trial. You have a 2 out of 3 chance of getting the real thing, and you will be contributing to combating this public health pandemic.
You bet. Jill?
Stephen wants to know, why would someone participate in stage 3 trials and risk receiving a placebo when vaccines are just around the corner?
That's a great question.
Yeah.
What do you think, Barbara?
Oh, that's an easy question to answer. I just volunteered myself to be part of one of these clinical trials. I'm not allowed to be part of the one we're doing at KUMC because I'm an investigator, so I'm actually going to our competition, if you want to call it that way, but in reality, it's not competition. We're all humans living in this planet trying to curb this virus. The only way we're going to be able to do that is if we complete the clinical trials. So I understand that vaccine is coming, but what the people have not quite heard yet is we will not have enough vaccine available by the end of the year or early next year to give it to every American. And some of us are still going to need to wait until there's enough vaccine distributed to access it. Healthcare workers obviously are going to be a priority, but there's other people that won't be able to get it. So we have to do the studies because, as you have heard many times, the anti-vaccine people that don't believe in vaccines, need to be reassured that we continue to do these studies as well as the public in the correct way. And the correct way is to do placebo-controlled clinical trials. So we're going to continue doing them to make sure that we can provide the safety that is needed. And I am one of those volunteers. So absolutely, everybody should do it.
And Mark, I would say that message is really important because there's going to be many folks who won't even get offered a vaccine until probably next summer or fall or something like that because there's just not enough doses to go around. So participating in trials still can be a good thing.
Yeah, no, absolutely. And as has been pointed out that, having different types of vaccines, and especially if they all work, and maybe some are more effective in certain circumstances than others. And so getting these they all seem very promising. So getting them completed will give us just more information, more ability to get the vaccines out quickly and to more people as well.
Yeah, makes sense to me. So great question. That's a great question from one of our listeners. So if somebody's in the trial, when do they find out that they've got a placebo and they can get back and they can say, well, I want to go get a real vaccine? How does that work out? Mario?
Yeah, as soon as the vaccine is approved by the FDA, then we will be contacting our individuals to let them know about the ability to come in if you got placebo, to come in for the vaccine. So this is something we have a commitment from the sponsor, is that if you receive placebo, then you will have access once this medication is approved. So this is, one other benefit from being in a trial like this is that you have access to resources, healthcare professionals that will help you. If you do get an infection, you will have immediate access to come in and get tested for COVID. And you will also have health monitoring devices that help monitor your oxygen level, monitor your heart rate. All this will be provided as part of the clinical trial. That's not part of our routine clinical care. And so that special attention you get from participating in clinical trial is another benefit.
Hawkeye, I've been in a few clinical trials before, and I've always found that the way I got treated was great.
Yeah.
I felt safe. I bet you've been in a few. I know you've done a few.
I've done a few. I haven't been in any, but I think to answer that, the other answer to that question is, there still is a sense of duty. And just as you stated, even though, for the past few years, we've seen a lot of sense of I and me and what I want, it's we the people, and there still is that sense of duty out there. And if you read some of these stories in the media about people and why they're doing it, they say because they feel it's their sense of duty to help their families, to help their community, to help the country. So I think that's another big driver of a lot of this as well.
Angela wants to know, is the AstraZeneca trial enrolling people that are older and immune compromised?
Okay, great question. How about older folks or immune compromised, team?
Yeah, our goal is to enroll at least 25% of our participants over the age of 65. Immune compromise really depends on what medications you're taking and what underlying disease is causing your immune compromised status. That's something we will review with you as part of the trial. You may be eligible, but you may not be eligible depending on what medications you're taking.
And people are asking again, if I sign up and I get the placebo, are you going to let me know that I had the placebo?
Okay. So let's take on the placebo question a little bit more, because we're still getting a lot of questions rolling in about that. So if somebody gets the placebo and now Moderna's vaccine is out there, can they either if they're offered, could they go get a second vaccine? Or how does that affect the trial, and how does that work?
Well, if they've received the placebo in our clinical trial, we would like, of course, them to maintain in the clinical trial till we know whether or not this vaccine is effective. The problem, if you go out and try to get a vaccine from that's been approved or under the emergency use authorization as participating in our trial, you have now eliminated your contribution to this trial. You no longer allow us to truly figure out if this vaccine is helpful. The other problem is that we don't know what happens if you take two different vaccines. That's never been studied. It is likely that there will be a heightened side effect profile, reactogenicity to that. And so that is a very concerning thing. And what we've told our participants so far is, please keep in touch with us. Please let us know. We know that you have free will and you could go out and get another vaccine, but at least allow us to know that so we can contribute that information to the trial.
And Mario, if somebody, you said that once the vaccine's approved, is it the EUA that's approved, and then you let people know? Because that's predictably quickly, or does the drug have to be fully approved and receive full FDA approval?
Has to be full approval.
Okay.
It's a key difference between the EUA and full approval. And that key difference is once we have over 50% of the participants enrolled into the trial, the FDA will allow them to apply for the EUA status. But we still only have 50% of the information. And so what we need for full approval is we need that whole body of information so we know truly what the side effects are going to be and how efficacious that vaccine is. And so those are really important endpoints that will help us move forward. The EUA status is really that, an emergency use authorization. It's really trying to get our most vulnerable individuals protected early on. But that's not the end-all game. The end-all game here is to complete the trial and get these vaccines out to the public that are approved.
So Barbara, I think one of the questions is how long before there's enough vaccine for every American? What kind of thoughts do you have? What kind of range are we giving? Because I think that was an important point earlier, that since we're probably not going to have enough vaccines for everybody, making one way to make sure you get a vaccine, you can get tested if you get sick, you get home monitoring equipment, is to be a participant in the trial. So how long before we think every American can even get a vaccine?
So I think there's two ways that I would like to answer that. For us to be able to get enough vaccine for the entire United States, we need to finish all the clinical trials that we're doing. So the altruism, the ability of us to understand that we need to do our part to be able to bring the country back to normal means some of us need to volunteer to do clinical trials in order for others to benefit from getting the vaccine. Pfizer and Moderna have finished their enrollment, that's great, but they don't have enough capacity to produce enough vaccine for the entire United States or the world. So we need to finish the other clinical trials, and that's part of the importance of being part of the clinical trial. Now, if we allow other clinical trials to enroll and people volunteer to do their part to help the world, then we'll be able to get vaccine manufactured from all these different companies faster to get everybody in the United States immunized. I do not think that we're going to have enough information or vaccine for everybody for probably another year. It may be that I'm wrong because this messenger RNA vaccine technology can be produced very quickly. My concern is the distribution, and the country might be able to figure out how to do this quickly and fast, but the world will not. And as long as the disease continues to circulate somewhere else in the world, I want Americans to remember that our life here is not going to go back to normal.
Right. And the good news, one of the things AstraZeneca has said is they will make sure this vaccine is available to everybody in the world. I mean, they've had a really good soul about this and saying we'll make sure that everyone has a chance, and even if we have to provide it at no cost. So they've really taken a great public stance, I think, on how to do that. So.
Still a lot of vaccine questions, but one off topic. Tammy wants to know, is it safe to come to an ER?
Oh, yeah, Dana, I think it's safe to go to the emergency room. What do you think?
Yeah, it's been safe for months, absolutely. We have all of the PPE, all of the procedures, protocols, all of the systems in place to keep you safe from the minute you step in through the door to the triage to getting you back to the room and evaluated. It's absolutely safe to go to the ER. It's absolutely safe to go to your clinics. Keep up your preventive health care. It's safe for the peri-operative services, anything you may need. That is one thing that we have gotten very good at and learned from, and really finalized all of our systems for that, for your safety, for patient safety.
Are kids in the trials yet?
Are we enrolling children, Barbara?
Pfizer is enrolling children at other sites. We are currently trying to figure out if we're going to be able to do a pediatric trial here in Children's Mercy Kansas City. Unfortunately, because of the halt that we had with AstraZeneca, all our Children's Mercy coordinators are tied up doing this AstraZeneca study, so we don't have the staff at the moment. So I'm trying to figure out if we can find research coordinators that are interested in working. Please reach out to Mario or to me so that we can hire more people and bring the pediatric clinical trial to our city as well.
Cindy wants to know, if tested positive people are going to need a vaccine or less of a vaccine, will they be in the last group?
What do y'all think? What group would they be in, Mario?
Well, currently at this point, if you've had an active COVID infection that is proven to be COVID, you're not eligible for our trial. Now, what we do know about previous infections is that reinfection does occur. And that varies in individuals in terms of that how long does your immunogenicity last? How long do you stay protected? And so I imagine in the near future, we will be recommending even those that have had the COVID infection to get a vaccine, but we're not quite there yet.
Jill, one more question.
Carol wants to know if I submitted my name to Shelby and I've not been contacted. Does that mean I did not meet the criteria?
How's that play out, team?
Well, it's purely not because you didn't meet criteria. It's purely lack of, as Dr. Bahoud mentioned, enough space and enough staffing to get people in. So I encourage you to reach out to Shelby again, and we'll get you in.
All right. I want to thank Mark and Barb and Mario for being a part of this program. These guys are frequent visitors. You're going to get your frequent flyer thing here in a minute. You get to move up to a first class seat, whatever that brings you. I want to say thank you. Mark, I want to talk a little bit more for just a moment about the mask mandate. You know, when Governor Kelly called for a statewide mask mandate yesterday and asked for bipartisan efforts to get the spread of the virus under control, I thought that was a great moment. You and I and other CMOs across the metro have gone on the record several times in support of masking as well as the pillars of infection control. The governor's masking protocols announced yesterday are a critical step in that crisis moment. Any other thoughts that you want to add to that?
No, I mean, as I said earlier, absolutely support anything that improves compliance with these pillars of infection control that we know absolutely work. And obviously wearing masks is one of them to not only protect ourselves, but to protect those around us. And as I said earlier, there's evidence that where there are mask mandates that the compliance is much better. And so absolutely support these kind of initiatives.
They're huge. I think our CMO group would as well. And Hawk, we know we actually saw some data in the counties that had mask mandates, lower infections than the ones that did not have it.
Yeah, absolutely. Early on, there was a couple small studies involving Illinois and Iowa, but since that time, we have just seen more and more local population studies, so county level, not just country level. And masking does help, along with those other mitigation strategies of distancing, not meeting in large groups, and hand hygiene, of course.
And remembering that if you really want proof, you just have to look at the hospitals, because every hospital has a hotspot of COVID and we're not getting spread. Masking clearly works. And so, well, we appreciate the steps that have been taken by the elected officials. We know we have to get everybody double down on our efforts. This is hard and we're tired, but nothing is more important than what we're trying to do right now. If the wrong actions are taken, we could be going into even a harder place coming into the December holidays. We also know wearing a mask keeps our economy open, and when combined with the other pillars of infection control, it helps us to shut down the virus and not society. While the news about vaccine gives us all hope, we got to take these steps now to bend that curve, curtail widespread community transmission, and ultimately decrease the hospitalizations. I want to again thank everybody who was on our program this morning. This has been great. I love having folks from Children's, Truman, and Mario with Hawkeye in here. It's the best to have you guys here. Thanks for being a part of this, and thanks for helping us push this message. Tomorrow, we're back to answer more of your questions. Amanda Gartner, Director of Safety and Quality, is back with us. We look forward to that. Hawkeye, any final thoughts today?
Yeah, I mean, I think on the topic of masks, because it is so important, even those studies that show that people got infected with masks, when you deep dive into that data, you understand that the people, those populations weren't wearing masks as they should have, and they weren't 100% in compliance with wearing the mask. And we've heard that from our guests on the show, too, that have gotten the disease. They take off their masks when they go to group gatherings, or they take off their masks in the restaurants, things like that. Just on the topic of vaccines as well, remember, still get your influenza vaccine. That is very important for this coming winter. Even though right now influenza activity is still very low, hopefully we can keep it low. As of about a week ago, there were 35,000 tests performed at clinical and public health labs in the United States, and they only had 36 positive influenza tests. So still very low activity, still time to get your influenza vaccine. And on the topic of vaccines, I did have a nationwide call yesterday with guests and experts from around the nation. There was a prominent vaccinologist, Dr. Greg Pollan from the Mayo Clinic, and he had a final thought of think positive, but test negative. And so hopefully everybody can continue to do that out there, especially in these coming holiday season.
We're going to steal that. Think positive, test negative. I
Maybe
like it.
Think and act positive.
Ooh, I like that
Test
too.
negative.
Yeah,
But
think and be
thank you to
positive.
Dr. Pollan for that.
Yep. Hey, as we close today, again, a shout out to Mark Steele from Truman Medical Center, Barbara Pahoud from Children's Mercy, and Mario Castro from right here at KU. not 314, and to everybody out there, thanks so much for being a part of the program today. Hey, as we close, a doctor from Canada recently made a social media post explaining that we are no longer the frontline workers, you are. I love that. We are the last line of defense. The front line has moved to the community. We asked 3 nurses and an emergency room tech who are caring for COVID-19 patients what that means to them. Here's what they said. We'll see you tomorrow. Remember, we the people. We the people. Thank you.
Good?
I've been in ICU for 12 years. I've never seen anything this bad and this sick.
Our patients are sicker than they've ever been. They've got multiple issues. It's affecting their whole bodies, head to toe.
One of the more heartbreaking things in the ER is hearing family members say, I wish I would have had my loved one do this. I wish I would have helped them prevent from getting this.
I mean, you're the one who's sitting there holding their hand as that tube's being placed, and you're the last face, that they might see. By the time they get up to us on the ICU, we are the last line. It's the last ditch efforts. We're going to throw everything we can at them, hoping and praying for the best. We want to give them the best chances at survival, but unfortunately there's only so much that we can do sometimes, and it's hard to see.
Our community, without them doing what they need to do, we won't have any other options.
At the end of the day, it's the community, it's the people who are, going to the grocery store, who are the front line now.
It's up to them. We need them to step up and really take it and own it and help prevent this from spreading. Otherwise, we're going to be in a world of hurt.
Right now, I would love to ask the community, help us help you.
If we can get people to just take that accountability, be responsible, do the right thing, even though it may not be the most convenient or easy thing, do the right thing and protect everyone.
Think of it like a marathon. This is a marathon, and it's not going to go away anytime soon. And with the holidays, we're afraid it's going to get worse, and we need the community to do their part so that it doesn't get worse.